Hi guys, I'm Maylin Dovan, certified athletic therapist and founder of Rehab-U Movement and Performance Therapy. I want to talk about the standard shoulder flexion test, a must in your shoulder assessment. I talk about the standing shoulder flexion test a lot. It's, to me, the most valuable test for shoulder assessment, for functional shoulder assessment. It's also a super valuable screen to see if people are ready and optimal for overhead movement. I do work with a lot of CrossFit athletes and people who have CrossFit as their training, as their sport, and so I do see a lot of overhead lifting and a lot of shoulder dysfunction relative to that. We're going to go through the standing shoulder flexion test and the different things that you might see and what that might be related to, and how in the movement optimization course we look at all the aspects of that test and plug that into a strategy. So if you're looking at muscle length stuff, you would plug that into your mobilization strategy. If you're looking at muscle performance stuff, you're looking at your activation strategy. And in the end, you try to integrate that as best as you can to progress someone towards overhead lifting. So the standing shoulder flexion test is simple, and the words describe it. The person is standing, and what you ask them to do is you ask them to lift their arms up all the way as high as they can. And you're looking for a number of things, and I'm just gonna have you do that a few times, Mike. So you're looking for a number of things, starting with the position of the head. So you're trying to see, do they push the head forward? Does the thoracic spine extend? Okay. If you're finding that there's not as much thoracic extension as you might like to see, and for full shoulder flexion, you need thoracic extension all the way down to T6, which is pretty low. Okay, so you're trying to see, are they getting that extension in through the spine? Are they pushing the head forward? If they're not, this might mean that they're lacking some mobility into thoracic extension. If they push the head forward, you're looking at cervico-thoracic junction, and you want to get some stability in that area. You can stop for a minute or two. So if they're pushing the head forward, what happens is the extensors tend to be very facilitated, and the deep flexors of the cervical spine are more inhibited. So doing an exercise like a chin tuck will help mobilize the upper cervical spine. The upper cervical spine needs mobility, and stabilize the cervico-thoracic junction. So where the cervical spine meets the thoracic spine, that needs stability. And if I get him to tuck his chin in, I'm creating that stability here. I'm working the deep cervical flexors, and I'm balancing out my cervical extensors with my cervical flexors. So I need a good cervical position to get a good shoulder position. Okay? A couple of other things you're looking at when they do standing shoulder flexion is, if you're from behind them, you're trying to see, does that scapula upwardly rotate 60 degrees? So if he takes his arm back down, what I'm trying to see is, does this medial border of the scapula, as he brings his arms up, does it rotate and give me a good 60 degrees? Okay? If not, you might be looking at tension, myofascial tightness in the downward rotators. Now, what muscles downward rotate the scapula? Well, among others, the rhomboids do. And a lot of people tend to be facilitated in the rhomboids. And one quick, easy way is to see whether, when he does abduction, so if he brings his arms out to the side, does he over retract the shoulder blades to get his abduction? And back down, palms facing forward. So see how he gets a lot of retraction. So these are just pieces of information at this point, and when you're doing your assessment, it's like data collection. So you're not analyzing yet, you're just collecting data and jotting down the data, and later on you put the pieces of the puzzle together. So it's like picking up pieces of a puzzle, but you don't know the cover image of the puzzle yet. Okay, so don't try to analyze everything, but just jot down what you're seeing and know that it might be overactive or facilitated rhomboids. Now, another thing with upward rotation is if they're missing some upward rotation in the scapula, the antagonist of the rhomboids is the serratus anterior. So it may be rhomboids facilitation or myofascial tightness of the rhomboids, and it could be lack in muscle performance of the serratus. So in your mobilization strategy, you might decide, I'm gonna release where the rhomboids are, I'm gonna create more space there, and then I'm gonna activate my serratus. So if you found that you were missing upward rotation, you'd be thinking, in my mobilization strategy, I need to look at rhomboids, I need to look at serratus, okay? Obviously putting this in through together with a full assessment of soft tissue limitations and so on and so forth. Another thing you want to look at when he does the flexion is, can he get to 180 degrees of flexion without extending through the lumbar spine? And if you see the rib cage rise, if I ask him to bring his rib cage down slightly here, you'll see that I don't quite get 180 degrees. Head is coming forward a little bit. So that would cue me to say, I'm going to look at his lats. I'm going to do a lats length test, and I'm going to see if there's limitation, a soft tissue limitation in the lats. And if I find one, you can put your arms down. If I find one, then definitely in my mobilization strategy, I'm going to release and attack these lats. Okay, so in my mobilization strategy, if I have found that there are soft tissue limitations, I'm going to treat those first. So mobilize or normalize muscle. So that means if there is actual limitation in the soft tissue, I'm going to stretch. If it's a performance thing, so if I didn't have a limitation in the lats, but he's still doing this when he does the shoulder flexion test, then it's a muscle performance thing. Then I'm thinking, okay, it's his anterior core that's not performing well enough to counterbalance that extension. Because you have to remember that it's normal for the thoracic spine and the upper back to extend when we flex both shoulders up overhead. But it needs to be counterbalanced with anterior core to bring you back and centrate that position. Okay, so if that's not possible, but it's not the lats that are tight and are pulling, then it's my anterior core that I need to focus on. And then I need to think about, I'm going to look at anti-extension exercises because I need to work that anterior core. All right, so that sums up the major things that we're looking at when we look at standing shoulder flexion test and how much information it can give you. But whatever pieces you get from that test, you're thinking, it might be lats, I'm going to test the lats. Because you don't just assume, if he can't get his arms to 180 degrees, you don't just assume that the lats are tight. You then go and test later on in your assessment, you then go and test your lats to see if there's actually a soft tissue limitation. If there is not, you're thinking, well, maybe it's more of a muscle function, muscle performance. So it's more my anterior core that's not able to counterbalance, okay, that extension that needs to happen for my arms to come overhead. Of course, all of the top things need to be cleared as well. So my cervicothoracic stability, my upper cervical spine mobility, okay, my upward rotators for the scapula. All right, so why this test is so valuable? Because it gives so much information and tells you where to spend the rest of your time in assessment, what to look at and what you don't really need to look at. So you're not going through a whole bunch of tests for nothing. It's telling you what you need to look at next in your assessment.